read because my first language, and sometimes I get lost in my words. I don't know if it's BAD or my English. Well, good morning. My name is Emerson. I'm a professor in the University Federal Brazil. And in these next 30 minutes, I will talk to you about the indigenous population and epilepsy. This work was done between 2012 and 2020, but patients are still followed up by me in health centers. I have the privilege to work with the indigenous population in my city because my city is very close to one of the largest indigenous villages in the Brazil. I will show you. This study was on the cover of the magazine Epileptic Behavior in July last year. For my presentation, I devised into introduction, those methods, results, and conclusions. Just remember, epilepsy is a chronic disease of the brain that affects people of age. Around 50 million people worldwide have epilepsy, making it one of the most common neurological diseases globally. Nearly 80% of people with epilepsy live in low and middle income countries. It is estimated that 70 people living with epilepsy could live seizures free if properly diagnosed and treated. 3/4 of people with epilepsy living in low-income countries will not get the treatment they need. In many parts of the world, people with epilepsy and their families suffer for stigma and discrimination. Here where I study, global. Here is the South America. Here is my state, South de Mato Grosso do Sul. And if you look more close, here is my city, it's Dourados. And here is the indigenous village. It's very near, 5 kilometers. And when we study, and village Jaguapirú is here. And here is the village Dourados, and here is Jaguapirú. Village in Dourados, there was 12,000 people and around 8,000 acres. And Jaguapirú village has 5,823 people, among the ethnicities Guarani, Kaiowá, Kadiawá, and Terena. About the stigma in epilepsy is very important in my city, my culture, because when you study epilepsy in indigenous populations, it's important to understand with the social effects the epilepsy differ according to several the social stigma, and they also vary among communities. The traditional indigenous health system, for example, are based in holistic approach which prioritize the harmony among individuals, families, communities, and the universities surround them. Healing practice are the produce the particular relationship with the spiritual world and means the environment which the indigenous community lives, reflecting the internal logic in each community. Here is an example of the testimony of the big village chief, the Mr. Getúlio. Here he was explaining to me what happened when the person is affected by seizures. A few words explain what the indigenous community understands what happened when the person is in prison. The chief and the communities understand that the spirits hold the people. For the other chief, for example, here, the family. The chief in the community, for the chief, all the crises are the consequence, the possession of the spirits. But the crises happen because the indigenous peoples are moving away from the cultures. Here is the nurse. The nurse Silvio helped me in the translation about the language, because indigenous language is Guarani, no Portuguese or other language. And the objectives of my study were characterization of epilepsy seizures, determination of prevalence, the epilepsy in the population, identify the risk factors associated with the development of epilepsy in this population, and the second time, determine the prevalence and nature of the paroxysmal events of non-epileptic origin. All the patients in the study signed the information consentment form in Portuguese and the Guarani, the native language. The first time the village health team was trained to understand and assist the diagnosis and the patient with the possible epilepsy. For this, I need to 6 meetings. The first moment of the study, I did the cross-section study with the objective to evaluate the presence of the epilepsy in the population. And second moment, I did interview, examination, and follow up these patients. Here is during my interview. Here the patient with epilepsy, and here the other patients with epilepsy too. And here, I don't know, maybe even at least.
Mas o remédio ele parava de cair no chão. Tá. Quando ele caía, porque ele ficava tremendo, apertava as mãos, mas ele puxava a mão, ele gritava, ele babava. Quando ele começou a ter ele parou de ter, só ficou nervoso. E agora ele parou de ter, tomar remédio.
Here, and this nurse is helping me identify the characteristics of the epilepsy and translate my information for this family. And my results of the 2,000 patients and around 2,000 indigenous people were interviewed. Epilepsy were found in 71 patients. Historic and isolated seizure was detected in 9 patients, and febrile seizures in 13 patients, and a clinical epilepsy was diagnosed in 49 patients. These patients were focused my study. Of the 30 patients, 52 patients is women. Ethnicity more prevalence is the Terena and 2,300 patients, and average age and 21 age, between 0 and 98 years. When these patients were analyzed by electroclinical evaluation, showed most were considered to have the focal epilepsy, and 71% of these patients, and 6 patients generalized, and 8 patients didn't have no identified the kind of the epilepsy. And when they studied these patients with the epileptic seizures, I see that 38% of these patients is temporal epilepsy, the characteristic temporal epilepsy. And we could not identify the etiology of patients in 41 patients because of limited access to imaging and genetic research. That investigation was requested to the Brazilian National Public Health Service, including the appointment with the geneticist. while we identify possible degrading factors or define the relationship between epileptic seizures and the sleep-wake cycle, no specific or a relative high prevalence factors was found. When we evaluate the possible variates relative to epilepsy, we observed neuropsychomotor dismovement alteration was present in 34% of these patients. I think is good now. I think it's the most important in my work. And about the treatment. I see an excellent therapeutic response was observed in first generation seizure medication and monotherapy. In most cases, 87% of these patients. Evaluated medications were phenobarbital, phenytoin, valproate acid, clobazam, and carbamazepine. When analyzed no epilepsy paroxysmal events among 82 patients diagnosed with paroxysmal events, no epilepsy, we found 30 patients with psychogenic seizures, 22 patients syncope, 7 patients headache, 6 patients in brief hold and spell, and 6 patients drowsy, 5 patients vertigo, and 2 patients in parasomnia. It's possible that a great number of psychogenic seizures occur due to cultural natures of the population. In my final observations, no difference were found between the 3 ethnic groups. It's important because when I begin my study, I think Hofberg's was more epilepsies no occur. And the conclusion, the prevalence of epilepsy in my study is 1.6, is the same to Brazil. Focal epilepsy corresponds to majors, the epilepsy seizures is temporal is more common. And the etiology of the epilepsy is known determined in 22 patients. Again, they observed an excellent therapeutic response with the first generation epileptic drugs in monotherapy is most case in 87% of these patients. The EEG contributes to the definition of focal epilepsy and help to diagnose the patients with seizures and no epileptic origin. Among no epileptic seizures, psychogenic seizures more frequently, and it's important. Even seeking help for traditional medicine, indigenous patients and their families believe that epilepsy is a spiritual disease. Here my team. Here is the first time when I group my team. Here the patients is my nurse. Is the patients to burn your arm because it's common accident in the fire. Here is the other patients. Patients is the Getúlio is the 2 others chief. Here is during my interview is my car during my interview. Here my email if you have more questions. Thank you. If you have a question.
I have a question.
Okay.
Why did you guys choose Brazil as a survey location? Speak out, please.
Sorry?
Why did you choose Brazil as your survey location?
Because I live here.
Okay.
I live everything.
I didn't hear that. A lot of it I could not hear. So I didn't know that's where you were from. That makes sense. Okay.
I born in São Paulo, but I grew up in Dourados. It's a city. It's near to indigenous village.
Okay.
When I was children, I grew with the other indigenous children.
Okay.
It's very common in my city, indigenous around my city.
Okay, but I guess I was just curious, more so in depth. I was more curious as to not that there's anything wrong with it, but why were you choosing indigenous people to determine, what their statistics were with epilepsy? Was it just a form of gathering data, or what were you trying to discern?
Oh, okay. Because I chose indigenous. Yes? Oh, okay. Because when I professor in my university, and I think is some discrimination in the population in my city or in my work in my country. And I and my wife teach in the village.
Okay.
And when I study indigenous in the village, I saw some patients. I don't know, because continuous quiz, because they didn't have access to the phenobarbital.
Yeah. No, I mean, that's a perfectly fine answer, a great answer. It's your truth. I was just curious, how, just trying to understand how different people navigate their pathways.
Okay, and other fact is important. I like the history about the epilepsy, because it's the spirit is when you I think when I this work is my PhD.
Okay.
And when I told the University of São Paulo didn't have indigenous people. And when I told about epilepsy, my professor and others people in the judge, oh, it's perfect in epilepsy, but what do you talk about the spirits?
Right.
The spirits is this, and because the culture is more rich than epilepsy.
Okay. Now, is their language the same, or do they have a different dialect?
No, it's totally different.
Yeah. So how did you communicate?
Yes. Sometimes the indigenous told in Portuguese, but when more old people, more difficult to translate, and you need to get some indigenous translate for you.
Okay.
You mentioned that despite seeking out the doctors and the medicine, that the indigenous people still saw the epilepsy as a spiritual disease.
Sorry?
One of your final slides was that despite the indigenous people seeking out your help, they still saw the epilepsy as a spiritual disease?
Yes.
Yes. What was their thought about the pills? How did they?
It's important, because when I thought about epilepsy, for example, the Getúlio is the biggest chief in the village. I told, what do you think about the pills?
Yeah.
She told me the perfect phrase. She told me, I think it's good, but the pills only cure the sick, but spiritual, I cure. My treatment is complete your treatment.
Compliment.
So without her, it wouldn't have worked.
No, you need both.
Yes.
You need the pills and the treatment to the spirit.
Every practitioner on speed dial.
Thank you.
Okay. Thank you.
Thank you so much, Dr. Emerson, for your wonderful talk.